Hey everyone, welcome to Lillian Live in New York City. Thanks for tuning in. I know everybody's busy, holiday time. I'm here in New York, in the city, and we have a great interview. I wanted to actually interview Ashley Tedone, who is one of my best friend's daughters. Makes me feel old. I wanted to interview her. Actually, I just wanted to talk to her because she is a healthcare worker, and she had a baby all while being, all while in the pandemic. So I haven't had a chance to really talk to her. So I'm so happy that she's going to be on today. And Ashley is a board certified family nurse practitioner. She works in New York City in family planning. She was also 12 weeks pregnant when the pandemic hit. She continued to serve the ladies of New York City, offering a wide spectrum of time-sensitive family planning services, even as her belly grew and the pandemic ravaged around her. She ended up delivering a healthy baby boy, Finn, he's adorable, in August. Finn David, while wearing a mask, at the very hospital where she provided care to others, is where she delivered. You can follow Ashley at Hoya Girl 88, and we'll put up the banners in a little bit. And to find out more about what I'm doing, check out at HPV Alliance. So without further ado, we're going to bring in the superstar healthcare worker and mama, Ashley Tedone. Hi, Ashley.
How are you? Thank you so much for having me.
Thank you for coming. How are you doing?
It's been definitely a crazy couple of months between global pandemic, being a healthcare provider, being a new mom. It's been definitely a journey, but I am excited that there's a vaccine out there. There will hopefully be a light at the end of this tunnel, and just kind of excited for what's to come in the next couple of months.
Speaking of the vaccine, before we get into everything that you went through, are you getting the vaccine anytime soon?
Well, I actually got word today. It's very exciting since I see patients directly. So currently I'm on maternity leave, but I do go back January 11th. So time is ticking, sadly, but I am excited to get back. I am able to get the vaccine anytime starting tomorrow through my workplace.
Oh, you froze. Ashley.
Can you see me, hear me?
Yeah, okay, you froze for a minute. You said you're going to get the vaccine, and you could get it anytime tomorrow.
Yeah, as long as supplies are available. But yes, I plan on doing it next week. And fun fact, I am breastfeeding, and per guidelines, from everything I've read, from all the research out there, it is safe to get the vaccine while lactating. And so I'm hoping to pass on some antibodies to baby Finn. There's not that much research out there yet about it, but definitely safe, and just excited to protect myself and hopefully protect baby boy.
I know a lactation specialist, and I can give you her information if you're interested later on. Anyway, tell us what it was like being a healthcare worker at one of the New York City hospitals. How was that? I mean, I can't even imagine.
Yeah, it was definitely a crazy experience, something that will stay with me forever for sure. So, as everyone knows, kind of New York City got hit really hard and really fast in the beginning. And there was just so much unknown about this coronavirus and, how it affected people, what the kind of long-term sequelae were. What did it look like for pregnancies? Can you pass on the virus to baby? So really scary stuff. And so I'm a healthcare provider. I'm a nurse practitioner. I work in OBGYN, and I specialize in family planning services. And so it is time-sensitive care. We see patients for miscarriages, for ectopic pregnancies, a whole slew of things, but things that can't wait. And so, we had to work. And so definitely, just a really scary experience being pregnant. I think that's what really kind of freaked me out the most, just all the unknowns with this virus and with pregnancy, and having to interact with patients daily, having to interact with the staff around you. Really definitely a scary experience.
And I know your mom told me that you walked to work and it was like an hour or something.
Yeah, so I was definitely afraid to ride the subway. I feel like it's safe now, but just with all the unknowns, I did not feel comfortable being pregnant and being on the subway. And I also didn't feel comfortable being in an Uber or a taxi. And so my office is in Midtown Manhattan and I live downtown. So it ended up being like a 2-mile walk each way. And I would walk from home to work every morning and every evening until I delivered. I worked till the morning. I was doing patient visits when I started having contractions. Luckily, I was at home doing virtual visits, but I went to work seeing patients until 37 weeks pregnant. So it was definitely quite the walk with the swollen ankles and the large belly. And in the beginning, my walk took me through Times Square. And it was just so desolate. It was really kind of like this stark image, being a New Yorker, being this proud New Yorker, and just seeing, nobody out there besides kind of police officers, firefighters, and people in scrubs. So I was with all of them. So yes, and my husband would actually walk me to work every morning to keep me company. Yeah. And then he would meet me on the back end to walk me home as well, so that I wasn't alone. And I think it made him feel like he was, fighting the good fight with me as well. So really sweet. He's a good one.
That is so nice. I don't think I knew that. Where can we get one of those?
I
That
know.
is awesome.
Yeah. So, really, I was quite fortunate.
But you know what? I think you deserve like a plaque or a medal, because that's, I did the hospital, did the coworkers, did everybody recognize that?
Yeah. It's like, oh, did your husband walk you today? Oh, your husband's waiting downstairs for you. So, everyone was, proud of him, proud of me. And, I was the only pregnant person in my office at the time. And so I think everyone was very grateful that I was still coming in to see patients. And, we're really supportive of the whole pregnancy, fortunately.
So what was it like? I mean, what kind of were you yourself dealing with COVID patients?
So, not people who knew they were COVID positive. So I only work in outpatient. As we know, patients can be asymptomatic and carry, the coronavirus and pass it on to others. So those were the ones that were really kind of the scariest, because obviously if patients were having any sort of symptoms, they weren't coming into the office. We screened them ahead of time. We did temperature checks ahead of time. And the only time we would COVID test was we do procedures in the operating room for certain circumstances. And all patients who were going to the operating room needed to have a COVID test. And so I actually don't think we've probably screened like hundreds of women. We've maybe had 1 or 2 COVID positive patients. So to answer your question, no, not dealing directly with COVID patients, but always the chance that a patient was, COVID positive.
And when you did, because I know for myself, I still went for my exams during the pandemic. I know my doctors not only would have a mask on, but they had a visor on, and they had, I don't know if they were all suited up like they would be in a hospital, but is that what you had to do?
It was an N95 mask. And I wear glasses, so it was always, heating up my glasses, and then a full visor for the protective eye shield. And then I would just wear scrubs and my white coat. But imagine, these summer months, it's really hot. I'm like 30 weeks pregnant. I'm already kind of swollen. I'm already nauseous and overheated as is. I'm wearing all of this, this protective equipment, and then having to do procedures, right? So having to place IUDs, having to place arm implants. With my favorite was when Baby Finn would kick me while I was doing these procedures with all of this equipment on. He wanted to be a part of the action. But yeah, there were definitely a couple of times I thought I was going to pass out, for sure doing a procedure, just because it was so hot.
Well, I'll I'll tell you, you will definitely have a story to tell Finn when he gets older. That's for sure.
Yeah.
That's a story. And we're gonna get to that, the pregnancy part in just a few minutes. So what do you think in the whole, like, what was your most memorable day at the place of work through the pandemic? What's been the most memorable, whether it's bad, good, shocking, not, what's been the most?
It's kind of a big memory.
Okay.
I'm so amazed by the resilience of these women who were coming into the office to receive care. We obviously halted non-time sensitive care, like patients who needed pap smears or annuals, just kind of routine stuff. We halted those visits. But women were having procedures in office. Like I said, we do miscarriage management, we do management for ectopic pregnancies, and we stopped allowing partners or support people in the office. So these women were coming in by themselves during a global pandemic, with masks on, coming to this oftentimes new environment, and having these procedures during an already really stressful time in their life, obviously, a miscarriage or an ectopic pregnancy. And women were just so tough and so brave. And we built this, relationship with them because we were not only the provider, but we were the person, their support person. We were the ones getting them through this really difficult time. So that kind of just sticks with me the most. Just how brave and strong, amazing, our patients were.
Did treating people who were pregnant and had those issues, did that make you nervous? I mean, or were you any bit more nervous?
In just in the line of work I do, I don't think I believed my pregnancy was real until he was actually in my arms. Because I have seen everything go wrong with a pregnancy you possibly can. So then just added kind of this global pandemic on top of it and all this unknown about what exposure means and what it can mean for baby. Yeah, it was definitely not how I expected my pregnancy to be whatsoever, for sure.
Yeah. Well, I know you're a trooper. You really are. And now I know the numbers are ticking up. Is it similar to what it was back in the beginning, but now there's a sense of, okay, we know what to do now?
So the numbers are definitely on the rise again in New York City. My hospital is almost at ICU capacity, and they've had to rearrange certain units to make them COVID units. The positive thing, if there's any positive thing, is that we now know how to treat this virus a little bit better. And so in the beginning, no one really knew what to do. And now we do have, medications, and the doctors who are on the front lines taking care of these patients definitely have a better grasp of how to manage these symptoms in these patients. So we're not losing quite as many lives, I want to say, at least at my institution. But yeah, I mean, it's definitely, it's still out there for sure.
That's good. And I say, like, a shout out to like you did, for those women that came in, even though it was a pandemic, because, um, even the American Cancer Society, I was speaking with someone there the other day, and they said, people are missing their appointments, and so they're finding things that could have been found earlier because the people are scared to go to the doctor or, to the facility.
Who are overdue for their PAP as a follow-up to an abnormal. So like I said, we halted kind of routine if you were just due for your PAP, every 3 years, every 5 years. But if it was a PAP smear to follow up an abnormal, then we were having those patients come in. And yeah, we still have patients who don't want to come in, and I get it. I mean, it's scary. We have patients who are older, who have really chronic illnesses. It's definitely, it's a tough situation. It's a scary time.
Well, I know that you thought your patients were amazing, but I have a feeling they thought you were, and your coworkers also. Um, so now, why don't we talk about your pregnancy? And I know you delivered at the same place that you work. I want to hear all about that.
Yeah, so like I said, definitely not how I imagined being pregnant. But luckily, pregnancy was healthy, baby boy was healthy. But my partner was not able to come to sonogram appointments, any visits. So I would send pictures or, FaceTime him in so he could see the baby move on the sonogram or hear his heartbeat. Um, I felt very fortunate that when I delivered in August, they did allow partners to be present. And so at my institution, and it was different across New York City, there was about a 3 to 4 week time period where women had to labor by themselves. No partners, no support people were allowed physically in the building. And so I had all these mixed emotions about this, right? Because as a nurse practitioner, as a healthcare provider, I knew the science and I knew that the point of that was to protect all the healthcare workers. And I got it. I understood. But then as this mom to be, this first time mom, I could not possibly imagine having to go through labor and delivery without, your partner, your support person. I had quite a traumatic labor and delivery. I labored for 36 hours. I pushed for 3.5 hours. There's no way I could have done that without my partner. He was right by my side. I mean, I guess if I had to, I would have. But I commend the woman who had to do this, alone. But I was really grateful that my husband was at least allowed to be there throughout the whole process.
Yeah, because what were the women doing? I guess they would have maybe one of the nurses step in.
Yeah, I mean, nurses, doctors. I mean, that kind of became your support team, and then a lot of FaceTime with partners. Um, Obviously not quite the same. Your partner doesn't get to cut the umbilical cord if they want to, or hold that baby or see that baby, immediately, and then they're on postpartum by themselves too. So they go 2 or 3 days without seeing their partner or their partner meeting baby. So really, really tough stuff for women.
So you were in the hospital for a little bit, but your husband was there.
Yes, he was able to be with me the whole time. For women who were in labor, they COVID tested us and they also did antibody testing. I was negative for both. And then they just did temperature checks for partners. They didn't test partners, but we both had to wear masks the whole time.
Wow.
So imagine 36 hours of labor wearing a mask the whole time. It was definitely an experience. But yes, he was able to be there throughout from start to finish. And so was just so grateful. I mean, it was kind of sad not having family members coming to visit us. But it was kind of special just having it be the two of us and the baby, like this little close-knit unit. Yeah.
When the baby's born, do they put, I mean, I don't know if this sounds silly, but do they put a mask on the baby? Like,
so they immediately just placed baby on mom, no masks or anything. The protocol was a little bit different if mom was COVID positive. I don't know exactly what that entailed, if they separated mom from baby for a period of time. But no, I got to hold baby. Well, Finn came out feisty. He came out non-responsive, which was really something. And so, yeah, when they placed him on me, he was ashen and not responding, not crying or anything. And so, in the movies, you see this picture perfect scenario where baby goes on mom and it's this beautiful moment and everyone's crying. And I was screaming. I worked in pediatrics, inpatient, before I did OBGYN. And so I immediately knew something was wrong. And so there was about 15 people who came running over. They took baby, they placed him under the lights, and they had to give him oxygen. They had to do an ambu bag to give him some extra support. They had to suction him. It was the longest probably minute of my life. Yeah, it was really scary. but then luckily he cried and was a-okay. But
Wow.
really really tough stuff. He also needed an ultrasound in the hospital, and I wasn't able to go with him because of COVID. So you have this new baby, and then they separate you from him. A nursing attendant had to bring him down for ultrasound. So I found that really tough. I also ended up needing some additional infusions for high blood pressure. And because of COVID, I again had to be separated from baby. So you're trying to establish, bonding and breastfeeding, and then to be taken away for a couple of hours is really quite traumatic after having gone through labor and delivery, and you have this
Yeah.
kind of COVID cloud hanging over you as well. So yeah, it was not quite the experience I had imagined, but so grateful that Finn is healthy and well and thriving, and he is still every bit as feisty at almost 4 months old.
That's so awesome. And what was it when he came out? What was that he didn't cry? What is that?
Probably just had I think he probably just had some extra kind of like saliva or phlegm in the back of his throat, because I labored for so long. Like, he was in the birth canal for about 3.5 hours, and he kind of just came out stunned from that experience. Yeah, it was really scary. And then
Huh.
because of the traumatic birth, he actually screened elevated for a really rare condition, Duchenne's muscular dystrophy. So we found that out at our 2-week appointment. So, our world kind of stopped for 2 weeks because they had to retest him, and we had to wait 2 weeks for those results.
Oh.
But it was all due to the traumatic birth. The marker they used was falsely elevated because he was in the canal for so long. So it was just, it's been quite the experience.
Wow. I was thinking, with I know when I was born, my mom, they had trouble getting me out. I maybe wasn't ready. But they took me out with forceps.
They'll do that. They still do that, and they still do kind of like vacuum assisted birth if need be. He was descending. He was just taking his sweet, precious time coming down. I made a really cozy home for him, I like to say. And so that was one of my questions, while I was laboring. I was like, is it time to use something? Is it time to have a C-section? But because he wasn't in distress and he was making his way down, they decided to not use any additional instrumentation, thankfully.
And you
Yeah.
know what else I was thinking? Boy, those doctors that were working with you and around you, they knew. I mean, I'm sure they're top dog anyway, but they knew they had to be on top because they have somebody who knows what's going on at every moment, right?
I said, I always say ignorance is bliss. Like, I wish I knew less in terms of like the OBGYN world, just because, I knew everything that was going on, and that was almost more stressful. But the care that was provided on labor and delivery was superb. It was exceptional. So was really happy, obviously, that baby Finn made his debut safely, and he's doing well.
Yes, and I got the lovely holiday card, and he's like a little man, I have to say. You could tell right away when he was born that this is a boy.
Yes, he is every bit a boy. He is a very strong personality. I like to think like his mom. He's very feisty. He definitely knows what he wants. He is the boss of me and my husband for sure already, and he's only 4 months. So we'll see. We'll see what happens.
Well, I can't wait to meet him and see you. And I'm so glad that you came on. I want to share your information if anybody wants to get in touch with Ashley at Hoya Girl 88. And also, Ashley, I'm so glad because I know we haven't had a chance to connect, and very close to your mom, and I just can't believe that she's a grandmother. I'm like, I don't know I don't know where the time went. I felt like we were just in Italy the other day, and you were crying for her to come home. Of course, I had to bring that up, but I'm really happy that you came on. You look great, and
Thank
I'm
you.
glad that you didn't get COVID and that everything turned out great. And
Yeah.
I think you could write a little book on this.
That eventually I hope to write some sort of like short story
Yeah.
about our experience.
Oh yeah.
But yeah, it was, being a new mom is kind of this whole crazy experience in and of itself. And your identity changes and it's kind of, isolating in and of itself. And then to add this global pandemic on top of it, it was, yeah, it's been tough. But I feel like we're coming through the other side. I'm going back to work soon. We have really great family and friends. Everyone's been so supportive. I wish I got to see people more. But with COVID, we're trying to keep the baby as safe as possible. And I just look forward to the day everyone, or most people get vaccinated, so that we can achieve some sort of herd immunity.
Yeah. So you're with your mom for Christmas?
She is currently manning the baby. He is screaming upstairs because it is
Okay.
time to feed. But yes, here for the holidays. But just us, really, really small, just 5 of us. And then we'll be back in the city. Well,
That's
we're going to
fun.
see my dad as well, and just my dad's family, and then back in the city.
Well, if you want the name of that lady, the lactation specialist, just let me know and I'll get it to you. And I'm so happy you're doing great and baby Finn's doing great. And I really do think you can write a book because it's having a baby in a
Yeah,
pandemic, having a baby in New York City in a pandemic, and being a
being a
healthcare
health.
worker and a
Yeah,
first-time mom. And
yeah,
oh
I
my God,
know. I know. Like it's layer on top of layer on top of layer.
it sure is.
But yes, well, thank you so much for having me, Lillian. It was wonderful to
Thanks,
chat with
Ash.
you.
Okay,
Happy
Merry
holidays,
Christmas.
everyone. Yeah, thank you.
Thank you, honey.
Bye
Thank
bye.
you. Bye. Thanks everyone for watching. I'm going to be taking a break for a couple of weeks, starting back up in January. I will be twice a month and focusing on HPV. You can find more about me and what I'm doing at HPV Alliance, hpvalliance.org, and have a wonderful holiday and see you soon. Be safe, wear the masks, stay 6 feet apart. Take care.